Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Yeah, we're back, and I want to talk about breast cancer treatment. There's new data showing women who have lumpectomy to remove the lump of cancer and radiation. This is for most women, not every woman, and that's true in medicine. There's never an always or a never, but this is for most women who have a lump of cancer found in the breast, and then are treated with lumpectomy, removing the lump of cancer followed by radiation. Actually have data showing better results than if the whole breast is removed. And I know many women, unfortunately or not, to me it's unfortunate because the data doesn't support it, choose to have mastectomy thinking that it's going to give better results. Now, everyone is the president of the United States of their body. So whatever you have, you get to make the decisions for you, and you live with the consequences, just like the president of the United States of America. So this data was put together and compared breast-conserving surgery, lumpectomy, and cancer-specific survival with early breast cancer compared to mastectomy. And there was a retrospective analysis that looked at 5 and 10-year survival rates. And this study was carried out in Utah. And after, again, I'm going to quote the author here, who is Charles Bankhead from MedPage. After controlling for differences among patient groups, breast conservation, women who kept their breast, they had breast cancer, they removed the lump and then had some radiation to the breast, had a 30% better survival than mastectomy alone. Wow. This was published in JAMA, which is the Journal of the American Medical Association. The authors said, and I quote, "Our analysis of a large and contemporary cohort of patients demonstrates that patients who underwent breast-conserving therapy have improved breast cancer survival compared with patients who undergo mastectomy for early-stage invasive cancer." So it's quite dramatic. It's quite important for everyone, for women and their loved ones, to know this data, because sometimes when you get diagnosed, it feels like getting hit by a car, and sometimes it's hard to think. So it's great to be prepared. My father used to say, chance favors the prepared mind. Now, this study looked at women who were treated between 1998 and 2008 with breast cancer less than 4 centimeters in size, that's about 1.5 inches, and 3 or less lymph nodes positive. They analyzed 132,000 women. So lots of women, big study. And the survival, if you have breast cancer, less than 4 centimeters, 3 or less lymph nodes, 5-year cancer-specific survival was 97% with lumpectomy and radiation. Mastectomy group was 90%. So you can see much higher results. And at 10 years, 94% of women were cancer-free, alive and cancer-free, versus only 83% with mastectomy. So you can see it's a 10% difference. There's 250,000 women in America a year with breast cancer, so you're talking about 25,000 lives saved. Huge numbers, huge differences, and something to think about. Again, if you have questions, give us a call, but really it's best to make a date, spend an hour, spend 2 hours, come in and review all the data in person. That's the way you get the best results, and you get to know everything. You know us, we know you, and we can spend time to go over all the details and find things out about you that you may not even know, which we're going to talk about in a few minutes. A woman who came in with what she thought was lung cancer that didn't have lung cancer at all. Wow. We're going to talk about that in a few minutes. I have another man who came in, just 50 years old. He's a Hispanic man, married, diabetes, 3 children. He had abdominal symptoms. He was placed on medications. Symptoms didn't go away. He was found to have a gastric cancer. So a gastric cancer, gastric in his stomach, within the abdomen. He was given some chemotherapy elsewhere, which he tolerated poorly. Then he had surgery. The cancer in the stomach measured 4 by 3.5 centimeters, so that's about 1.5 inches. And then they looked at 21 lymph nodes around the stomach, and 20 of the 21 lymph nodes contained cancer. So he was at very high risk with a pretty big tumor, lots of lymph nodes positive. He lost 30 pounds. He went from 160 down to 130 pounds in 4 months due to the cancer. He had the surgery. He didn't tolerate the surgery very well. He can only eat smoothies, and he has a feeding tube in place. And he came to us for evaluation of his situation. And what is his situation? Well, his surgery was in April. It's now 2 months later, and nothing's been done. So that's, number one, sad, and I think number two, not the best care. There's multiple studies that show that people that have adjuvant, which means additional treatment for gastric cancer, live longer than those who don't. You can imagine if the cancer has already traveled to 21 lymph nodes, it's very likely to have traveled to others. So we staged him up, meaning we determined the extent of cancer. We got PET scans and blood tests and physical exam, and we determined that there's no gross disease left behind. So we're recommending treatment in the stereotactic frame, which is our specialty. We were the first in America to use the stereotactic frame, and we have data showing benefit compared to no further treatment. So this is a man getting adjuvant treatment, which means additional treatment, just for about 5 weeks, so a short course, non-invasive treatment. Come in, get a treatment, and go home. Should be very well tolerated, should be guided by the images he had before and now. We have no evidence of disease, but we know that adjuvant therapy or additional therapy can help reduce the chance of the cancer coming back. He's 50 years old. I think that's what everyone would want. 50 years old, with 3 children, married. Yes, he wants to live, and he wants to live cancer-free. So we'll report back to you as he goes through the system and the follow-ups, which we often include in the program as the good news department. And we have another man who came to us with a Gleason 7 cancer. This was a 62-year-old Hispanic male, also 3 children, prostate cancer. He had an abnormal physical exam, so he had a digital rectal exam. He had a nodule in his prostate. He had a biopsy. The biopsy showed Gleason 7 cancer. This was done March 20th at a neighboring hospital in New York City. He had no staging. He was being pushed to get surgery. And he didn't want surgery. He knows that surgery can alter his sex life, it can take away his sex life and take away his erections, can alter and take away his urinary function. And he saw our data for Gleason 7 cancer, which you can open up the booklet yourself. There's plenty of data for Gleason 7 cancer. If you open up our booklet to page 11, you will see comparison data from 2 famous Ivy League hospitals. one in Boston, one in Philadelphia, looking at Gleason 7 cancer, treated with surgery, which is what they were pushing on him. The success rate for Gleason 7 cancer. So the cancer's confined. So guess what it is? If the cancer's confined, it's a Gleason 7, which is how it appears under the microscope. Gleason was a pathologist that tried to give us an idea of how the cancer would behave. If the cancer is confined, and it's a Gleason 7 cancer, and the surgeon cuts out the prostate, what's the success rate years later? It's not 100%. It's only 60%. So 40% of the cancers come back within 5 years if it's a Gleason 7 cancer, even if you go to a fine institution. Why is that? Well, it's a little bit like cutting a loaf of bread without making crumbs. And unfortunately, the surgeons for Gleason 7 cancer, actually for none of the cancers, but Gleason 7, we're talking about this man, has a high recurrence rate with radical. 40% of the cancers recur within 5 years, compared to our success of 90%. And without the radical surgery, without the stay in the hospital, our treatment is all outpatient in our facility on 38th and Broadway, with a 90% success rate at 5 years. So this man said, wow, sounds great. That's what I want to do. And that's what he's going to do. We got approval from his insurance company. We're going to go through the process. He has a stage T2 prostate cancer, Gleason 7. We'll start the treatment this week. And again, we'll report back to you from the good news department. We hope that's where we want to be. So we're going to stop just for a moment. Again, if you have questions, you're welcome to call us. We're live at the WR studios. I know a lot of you are shy. So the studio phone number is 800-321-0710, 800-321-0710, or you can call Radiosurgery New York. Our number you can call day or night, and that is 212-CHOICES, 212-CHOICES, which is 212-246-4237, and we'll send you a booklet and a DVD about either brain tumors and brain cancers, cancers of the body, that includes almost all cancers, and then we have a specific booklet for prostate cancer, which we'll mail to you with our data and comparison data. So again, we'll be back just in a moment after this short message.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day, because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Yeah, we're back, and just want to relate some information that came out about resveratrol. You probably remember this chemical that's in red wine and dark chocolate and grapes, and it's supposed to make us healthy and happy and all those other good things, resveratrol. Well, there's new data on resveratrol that looked at the senior population of 2 villages in Italy, 783 men and women aged 65 and older, whose health and resveratrol intake